Howdy everyone, Matt here. I got a question for you. Is it more profitable if you're running a clinic in some capacity, either for like a corporation or by yourself, to be more evidence-based, using those movements and exercises to get people better? Or do you utilize modalities that keep people coming back because it feels so good? Well, let's talk about that. But first and foremost, let me introduce myself. My name is Matt the PT, coming at you with another video on another topic of something in the physical therapy world. Second of all, thank you so much for the likes, the comments, and the subscriptions. Thank you so much. It means so much to me. And if you do so like the content, hit that subscribe button down below. It won't cost you a copay or anything like that. So I want to talk about modalities, and modalities in terms of a way to keep people coming back and doing therapy. Now, I will say that modalities seem to be very synonymous with physical therapy. I mean, if you ask people about what they did in therapy, they're going to say that they did some sort of modality. Oh, they put that tingly thing on me. They put that stretchy thing that pulled on me, or they rubbed that stuff on me. They talk about some of those things. And even those over-the-counter products out there that sell like, oh, physical therapy at home are often some sort of modality thing. It's something that, that does heat or the stem or a massage. It does something, and they push it as physical therapy. But we often know as PTs and PTAs that that's not all we do. We do so much more. And modalities is a small aspect that we do. Now, I also know and understand there's a big push against modalities in terms of being like heavily reliant on them. And that's what I'm saying, being heavily reliant and saying like that's all it is. And that we push and understand and talk to people about rehab is much more active. You need to be active in your rehab and doing stuff and we talk about that. And we don't want to be known for doing those things. And we seem to like talk bad. Maybe not talk bad, but don't have favorable views when it's just these modalities. But I will say, in my experience, and this is coming from my experience of going through this and what I see and things like that. Now, of course, I want to hear your experience and what you see about this as well. Comment that down below. But I see that a couple things. One, people that run clinics in some capacity, typically more of like a cash pay or their own private practice, are very quick to promote the modalities that they do. So the electrical stem or, traction or these new devices that are coming out, that they really market those things. And I have seen over my career the ways that working for corporate, these bigger PT companies push it as well. And I'll give you some of my experience with it. Now, early on in my career, many, many years ago, sitting in the first staff meeting, we were talking about unit count on it. And, I'm just taking this all in. And this has been a common theme for many, many, many years of sitting in on these staff meetings, is unit count in it. And they want to say, this, how many units we're billing per patient, what each therapist is billing per patient. And most of the time they would have what they wanted you to bill would be like 3.85, 3.87, something like that. And then you would get these things about how to, increase your unit count. If you do this, you can get all this. And, we always talk about the billing, how to increase billing. Because again, when you treat patients and you have your clinic, you do need to make money because it keeps the lights on and it can help you expand your, there's a whole other aspect to go in there. And we just make sure that we're doing everything right. But I remember getting a good amount of praise in there by seeing if you kept your unit count high. And I figured out, and I'm just talking about this is old me, many, many years ago, saying like, okay, I was very hands-on with like everybody that came in. Everybody got some form of manual therapy on them. I didn't do a lot of massage. I'll tell you that right now. But some manual therapy on them, so I could bill a manual therapy unit. They would get 2-3 units of therapeutic exercise, therapeutic activity, neuromuscular re-ed, something like that. And of course, when done, all right, let's slap you on the heat and the E-stim or the ice and E-stim. Well, let's put you on that. We can really up that unit count on there. And that was great. And I carried that over to when I ran clinics. Kept that same thing. Hey, you really try to get them on this. Is an easy way to get another unit. And then, of course, the upper people would applaud, oh, you got this great unit count, things like that. Now, I will say, I did recognize as well, I didn't want people dependent on it. I didn't like people coming in just wanting that and only focusing on that. Or just trying to say like, that's all I want to do. I just want to do the passive stuff. Saying, no, you need to move. You need to exercise and do these things to help you. And of course, reaching a point where we wean you from it on it, and to say like, okay, no, we need, you're not going to have this all the time. As you're getting stronger, as you're getting better, we're going to get you away from utilizing these modalities. And it was always this also an interesting thing with corporate, with some of these places I used to be, that they would always talk out of both sides of their mouth. And I've said that several times, saying things like, you don't want patients dependent upon the modalities, just coming in for that. You don't do that with them. You start weaning them from it. You just do it. But then on the other side saying like, oh, you need to do what patients want, and that brings them back. And you can just, you just put them on that for 15 minutes. You get an extra unit. And if you, with your billing, it doesn't, like eSTEM doesn't pay very much. At the time you get $10, so you just add it. So it just helps your numbers. It would be those little things. And I will say, I went through that period of time where I was very like, okay, yeah, everyone gets modalities. Everyone's going to get modalities on it, and we're going to try to wean you from it. But then it kind of swung the other way. And I know myself, I went for a period where it's like, nobody gets modalities. I'm not even going to have them in the clinic. So the ones that then were supplied, I just put them away. Because if they're not out there, people aren't going to ask for them. And that's how I view it. If we don't have the stuff out here, people aren't going to ask for it. We're going to get you moving. We're going to do those things. And occasionally, if there was somebody who maybe did need something, okay, we could pull it out if need be. So I recognize that. And I'll tell you where my view is here in just a little bit with modalities. But I've been seeing this trend lately that people, especially that have, more of like people who have their own clinics, either a private practice that's cash pay or maybe their own where they take insurance, that they promote modalities in part of like their marketing material, their stuff like on their website or something in their handouts, and that they talk about those things. And I have legit seen several people's clinics, you go to their website, it looks like my therapeutic activity syllabus, where it lists literally every single modality. Just list them out. And I'm talking things like iontophoresis, phonophoresis, stuff. I was like, like you have this stuff? And I've seen with some of the new stuff, of course, I'm talking about shockwave. There's a whole lot of stuff on that. I don't want to get in, but red light therapy that have been thrown into that, of course, like cupping and scraping and needling, and they put these things almost like front and center. And I view it as, okay, those are feel good things. You're just really bringing people in to just to get them in with the modalities. And are you really, really being effective by doing those things? Now, I can understand that people say like, oh, yeah, well, we do these things to then get them over to exercising and get them, we get the buy-in from it. And I have seen that, and that's been the argument many people say like, oh, I've been part of business groups where people were saying, oh, I'm going to set up in this blank office that does some other kind of modality. I'm going to set up in this office and I'm going to offer PT services. And I've brought up like, you're just offering modalities, and that's not what physical therapy is. It's not the true thing of what physical therapy is. And are people getting the wrong idea? Because that's what they see. They see these modalities. That's what they're focused on rather than the exercise. And then that's what they're going to tell their friends, and their friends are just going to be coming. And so you're doing those things. And of course they got kicked out of the group over that. So, but I've just seen, and again, I've just kind of questioned it. And I've talked to people who have had their own stuff, and they said, yeah, I've utilized things like offering 30 minutes of dry needling, to do scraping for that, to do massage, to do cupping, as a way just to make extra money because people want it and they view as a physical therapist, that as a healthcare provider, as an expert in this, to say, oh, I'm going to come get these things and be treated. I kind of also, for myself, I feel very conflicted on it. So my views on the use of modalities now is that, modalities feel good. And I'm not going to lie about that. It feels good to lay on a hot pack. I like electrical stimulation. I have talked to patients about that, and I have prescribed TENS units and given that to somebody because I would say with a TENS unit or electrical stim, maybe you can't take pain medication because of one thing or another. Either like you have an allergic reaction to it, maybe you have some other issues, maybe as well you can only take it every 6 hours, but it wears off after a period of time. You can use some sort of electrical stimulation to kind of calm down your symptoms while you're waiting, before you can take the next medication. Or I'm trying to go back to work or to do these stuff. I don't want to be taking medication, and I can utilize a TENS or an electrical stim to help calm things down. Like I said, needling, I've been needled before. I have not had the scraping or cupping, but I've had those things, and they do feel good. And I look at it as a way to say, like, if you are in a good bit of pain and it's having a hard time moving, or you're hard time doing the big things that help you, these can be a way that you can modulate pain. Maybe it takes your pain down just a little bit or enough to a point where you can move. But understand, this is not going to fix you. Maybe somebody comes in, and I've had this, patients come in super stressed, very worked up, very long work day, with crazy drive, something, and they're just, hey, would you like to sit on a hot pack or lay on a hot pack for 10 minutes? Throw them on that. It kind of brings them, all that, their nervous system kind of relaxes them. Oh, I just needed that on it. And then it allows them to do other things. But we talk about, this isn't going to cure you. The bigger things that we're doing in here, the exercise and movements, are going to be the big thing. I don't make it a focal point. I don't get people really on it as well. But seeing that, again, getting people in the door, is it a way? Yes, it can be a way that you get people in the door on it, to say like, oh yes, we're coming in here and we're doing all these other things because we use them to get in the door. But as well, is it giving a very positive view of physical therapy, to say like, is it the exercises and movements and stuff, and that's what we're doing? Or is it just looking at the modalities? And again, that's what people knock on us about. Oh, you just do all these passive things and these light things. And that's what people really, really are about on it. And I also understand if you're a business owner, you have your own clinic, things like that, you got to stay in business. So maybe offering those things keeps you in business, because it's like, hey, if I do 30 minutes of needling for $50, that can fill 2 spots for $100, where I make $100 on it. Something that is, this person comes in every week or so. It keeps my doors open. It helps me provide for my family on that. Now, I will say, I do think that sometimes there are some less than scrupulous providers out there, or people out there. Just happens with anything, that use this just to, again, it's just a moneymaker. It's just money making. Oh, I offer all this stuff just because it just keeps bringing in all this money. And that's all I really care about, rather than really, really getting into these people. No, I know if I use these modalities, it's just going to keep people coming back and coming back and coming back. And I can just keep making that money just because I just fix them up enough to make them to that next visit, where they eventually may get better and resolve on their own. But I'm just doing the feel good stuff as they keep going. But again, to me, that's not a good reflection of it. I want to get you moving. I want to get you doing stuff like that. But using those modalities is very, very little as possible on there. So that is my take on it. That is my belief. I know I probably just rambled quite a bit, but I want to hear from you. What do you think about it? What do you think about how modalities are used? Do you feel like places are using modalities as a way to just get people in the door? And is that a positive thing? If you get people in the door, then you can do other stuff and you reward them with the modalities. Is there any harm with doing it? Or is it a good way to educate people about it as well? Or do you feel like, hey, you know what? I can make some quick money by offering this to help me with other things, let me know. It can be a wide, weird, hairy topic there. Let's talk about it a little bit more in there. Comment down below on it. So there you go, everyone. Like I said, if you enjoyed the video, hit the like button. Thank you so much for taking time out to watch the video. Please subscribe to the channel. Like I said, no copay cost or anything like that. And like always, take care of yourself, take care of your patients, and I will see you next time.